Hello, everybody. How you doing out there tonight? It's your guy. It's your man. Let's talk tonight about life. What's up, everybody? How you doing out there tonight? Tonight, I'm dedicating this show to a friend of mine. He asked me to do a video based on alcohol use disorder, also known as alcoholism. So, what I'm going to do is I'm going to give a little overview of what alcohol use disorder is, and I'm going to give you my personal experiences with alcohol and alcoholism. Okay. Alcohol use disorder, which includes a level that's sometimes called alcoholism, is a pattern of alcohol use that involves problems controlling your drinking, being preoccupied with alcohol, continuing to use alcohol even when it causes problems, having to drink more to get the same effect, or having withdrawal symptoms when you rapidly decrease or stop drinking. Unhealthy alcohol use includes any alcohol use that puts your health or safety at risk or causes other alcohol related problems. It also includes binge drinking, a pattern of drinking where a male consumes five or more drinks within 2 hours or a female down at least four drinks within 2 hours. Binge drinking causes significant health and safety risk. If your patterns of drinking results in repeated significant distress and problems functioning in your daily life, you likely have alcohol use disorder. It can range from mild to severe. However, even a mild disorder can escalate and lead to serious problems, so early treatment is important. All right, folks. So, this is what I want to say about alcohol and how dangerous alcohol really is. They talk about marijuana, they talk about all these other so called gateway drugs, but the biggest gateway drug, in my opinion, is alcohol. Why? Why do I say that? Alcohol in the United States and most countries around the world is legal. So you can drink starting at the age of 21 in some states, and you can drink till your heart content. Alcoholism causes more deaths per year than most gateway drugs. I haven't heard anybody dying from marijuana, but that's a whole different topic. I just wanted to say that, alcoholism will get a lot of people tapped into other drugs, man. Alcohol, a person that's inebriated, a lot of the times when they're around the wrong type of people, they can escalate their situation to something else, like cocaine or you know heroin or PCP or mushrooms or whatever drug. Alcohol usually is the first drug that people use. Most people don't look at alcohol as a drug, but alcohol is a drug. Some symptoms that alcohol use disorder can be, as far as the severity, it can go from mild, moderate to severe. Based on a number of symptoms you experience, signs and symptoms may include being unable to limit the amount of alcohol you drink. Major consumption issues, right? You drink one beer, you drink five, you drink 10, and you just can't stop. Wanting to cut down on how much you drink or making unsuccessful attempts to do so. So that's for a person, you're out there, you want to stop, but you can't. You have it in your mind, but you can't. The willpower. Spending a lot of time drinking, getting alcohol, or recovering from alcohol use. Feeling a strong craving or urge to drink alcohol. Failing to fulfill major obligations at work, school, or home due to repeated alcohol use. Continuing to drink alcohol even though you know it's causing physical, social, or interpersonal problems. A lot of people deal with alcoholism in that way. I had a friend, good guy, but he drank a lot. He had a beautiful girlfriend, but when he was inebriated, when he was drunk, this man did not know how to treat her. He always wanted to fight, always arguing, yelling, embarrassing, the young lady in the street. They can be in a house, he'll come outside. I mean, like, it was just horrible. Alcohol and consumption of alcohol in a mild to severe way can cause a lot of personal issues. A lot of personal issues, man. Social issues. You know, I didn't want to be around him when he was like that. And then when he was sober, it was hard to be around him because he didn't remember the things that he did. So, these are some of the things, Giving up or reducing social and work activities and hobbies so you no longer want to do the things that you enjoy doing. Using alcohol in situations where it's not safe, such as when driving or swimming. You have some of the, like I lost a good friend of mine, he was my podiatrist. I called him uncle, old Jewish guy, young person out there drinking, and they T-boned him. Old guy minding his business, going to handle some business, and he was T-boned. And guess what happened? The guy that was drunk is still alive, while my uncle is no longer here with us. So, guys, if you drink, make sure you have a designated driver. Try not to overconsume. Developing a tolerance to alcohol so you need more to feel its effect, or you have a reduced effect from the same amount. Experiencing withdrawal symptoms such as nausea, sweating, and shaking when you don't drink, or drinking to avoid these symptoms. So those are some of the things, some of the symptoms that you can have to make you understand that you might have alcohol use disorder. Alcohol use disorder can include periods of alcohol intoxication and symptoms of withdrawal. Alcohol intoxication results as the amount of alcohol in your bloodstream increases. The higher the blood alcohol concentration is, the more impaired you become. Alcohol intoxication causes behavioral problems and mental changes. These may include inappropriate behavior, unstable moods, impaired judgment, slurred speech, impaired attention to memory, and poor coordination. So when you're driving, that's poor coordination. You don't know, they say go left and you end up swerving to your right. That your coordination is off. You can also have periods called blackouts where you don't remember events. Very high blood alcohol levels can lead to coma or even death. Guys, this is serious. So this is not for the people who don't drink. This is for the people who do drink in consumptions where it's actually messing with the things that you do on a normal, and mess with the people that you might love to be around. And it can cause people to not want to be around you. It can cause you to put yourself in dire conditions where it can harm you, not just socially. Again, I know social issues come from drinking, but it can also be physical issues. You don't want to be in a coma, or you don't want to die because you felt the need to drink too much, okay? Alcohol withdrawal can occur when alcohol use has been heavy and prolonged and is then stopped or greatly reduced. It can occur within several hours to 4 or 5 days later. Signs and symptoms include sweating, rapid heartbeat, hand tremors, problems sleeping, nausea and vomiting, hallucinations, restlessness and agitation, anxiety, and occasionally seizures. Symptoms can be severe enough to impair your ability to function at work or in social situations. And guys, if any of you understand what I'm talking about or has been through these situations, please feel free to let me know. Leave it in a comment, or if you know someone who has dealt with these things. To those who have not dealt with these things, or know someone who you might know, like a family friend, or a relative, or a loved one, these are some of the signs you need to look for, because we are our brothers and our sisters keepers, right? If we love someone, we're gonna try our hardest to hold them accountable. We got to do that, because if we don't do that, then people just run rampant. So we want to make sure we know these things to look for. Just like a heart attack, if you see someone, having a heart situation or breathing situations, we know these signs. So it's imperative that we know the signs of alcohol use disorder. We got to know these signs, especially if we have friends and family and loved ones that may have mild to severe alcohol use disorder. What is considered one drink? Well, the National Institute of Alcohol Abuse and Alcoholism defines one standard drink as any one of these. So I'm going to give you 4 examples, and I want you to, really understand this is what it is, right? 12 ounces, 355 milliliters of regular beer. That's about 5% alcohol. You know, we got a lot of beers out now that has 6.5 and 9.5% alcohol by volume. If you have a beer that's 5% alcohol per volume, like a Heineken or a Budweiser or something like that, one 12-ounce can is considered one drink. Okay, 8 to 9 ounces, 237 to 266 milliliters of malt liquor, about 7% alcohol. So that means you went from a Coors Light or a Heineken to a St. Ides. And one drink, most people buy, I want to say, 24 ounces of malt liquor in a can. If you're going to buy it in a can, um, it takes 8 to 9 ounces. So it cuts down from the 12 ounces of regular beer to 8 to 9 ounces. That's one beer. That's not even one beer. That's like a half a can of beer, right? Now, let's go down. 5 ounces, 148 milliliters of unfortified wine, about 12% alcohol. You can only have one drink is considered 5 ounces. And 1.5 ounces, 44 milliliters of 80 proof hard liquor, about 40% alcohol by volume. So when we get a shot is usually an ounce. So that's considered one drink. So if you have 5 shots, you just went over, let's say, 7.5%. So that 7.5, let's see, 5, 6, 7, yeah, 7.5 ounces. 7.5 ounces is 5 shots of hard liquor. Think about that. You might more than likely be over the limit after having 5 shots. And, you know, a lot of us, we go out and we drive after that. We want to go out and we want to party and we want to drink and get nice and feel good and then go out on a road and we can possibly cause injury to someone else. Very selfish thinking. But in the name of fun, we don't realize that we are harming ourselves. But at the same time, we are more than likely going to harm someone else if we harm ourselves. We should go out and see a doctor if you feel that you sometimes drink too much alcohol or your drinking is causing problems or your family is concerned about your drinking. Talk to your doctor. Other ways to get help include talking with mental health professionals or seeking help from a support group such as Alcoholics Anonymous, AA, or a similar type of self-help group. Because denial is common, you may not feel like you have a problem with drinking. You might not recognize how much you drink or how many problems in your life are related to alcohol use. Listen to relatives, friends, or coworkers when they are asking you to examine your drinking habit or to get help. Consider talking with someone who has had a problem drinking but has stopped. I want to just say this, being the son of a drug counselor, being an alcoholic, I'm just going to say being an alcoholic or a person that has alcohol alcohol abuse problems, I just want you guys to know that you are always and forever going to be an alcoholic. So when you decide that you have had enough, just remember, right, that it's a day-to-day thing. You take it one day at a time. You don't have to prove nothing to anybody. And if you mess up, pick yourself back up, because guess what? That's the way of the game. You're going to mess up sometimes. But when you mess up, you have to always remember you can always stand up and start all over again, right? A few causes that that can be going on with people who's going through these issues, right? Genetic, psychological, social, and environmental factors can impact how drinking alcohol affects your body and behavior. Theories suggest that for certain people, drinking has a different and stronger impact that can lead to alcohol use disorder. And not to be funny, I lived in Anchorage, Alaska. And living in Alaska, I had a lot of Native American friends, the Aleutian Indians, right? Because they were from that region. They couldn't drink for nothing. They 2 shots and they were inebriated. They were, pissy drunk, falling out. So when they make that statement, theories suggest that for certain people, drinking has a different and stronger impact. I know for a fact that's true. Over time, drinking too much alcohol may change the normal function of these areas of your brain associated with experience of pleasure, judgment, and the ability to exercise control over your behavior. This may result in craving alcohol to try to restore good feeling or reduce negative ones. Now, remember I said earlier that alcohol is a drug, right? They talk about drugs in the same manner. They talk about crack and cocaine and heroin and barbiturates and uppers and downers and speed. And, they talk about these things and it's the same exact language. Yet alcohol is legal, which is fine with me. I don't have a problem with it being legal. But I do have a problem with my family, my friends, you guys, not realizing, if you don't realize, that this is also a drug, and this is the biggest drug that we deal with on a day-to-day basis, because it just doesn't always affect the person that's using. It affects everyone, and also people who have no idea what's going on surrounding them, because they might be driving or walking down the street and here come a drunk driver. Alcohol use, these are some risk factors. Alcohol use may begin in the teens, but alcohol use disorder occurs more frequently in the 20s and 30s, though it can start at any age. Steady drinking over time, drinking too much on a regular basis for an extended period, or binge drinking on a regular basis can lead to alcohol-related problems or alcohol use disorder. Starting at an early age, people who begin drinking, especially binge drinking at an early age, are at a higher risk of alcohol use disorder. This is real family history. The risk of alcohol use disorder is higher for people who have a parent or other close relatives who has problems with alcohol. This may be influenced by genetic factors. So when they say that, I can kind of agree with that. Okay, so if you eat, I'm going to talk about food. If you eat certain things while pregnant, right, your child will pick up whatever nutrients that animal or that vegetable have, right? You can say and do whatever you want, but when it comes to ingestion and ingesting things in your body, your seedlings, your babies can be affected one way or another, because alcoholism can be considered a genetic factor. If you have generations of alcoholics, I believe in willpower. I believe in people doing what they want to do. But 9 times out of 10, if you have generational alcoholism, it's not going to stop until that one person decides to stop it, because it's already embedded in the body and through generational experiences, right? So just remember that whatever you do can affect it could affect your children and your children's children and your children's children. So just remember that, okay? Depression and mental health problems. It's common for people with the mental health disorder, such as anxiety, depression, schizophrenia, or bipolar disorder, to have problems with alcohol or other substances. History of trauma. People with history of emotional or other traumas are at increased risk of alcohol use disorder. So history of trauma goes right hand in hand with depression and mental health issues, because emotional trauma is a mental health problem, okay? Having bariatric surgery. Some research studies indicate that having bariatric surgery may increase the risk of developing alcohol use disorder or of relapsing after recovering from alcohol use disorder. Remember I said earlier, you're always, no matter if it's alcohol or drugs or smoking cigarettes or sex, whatever, if you are in recovery of something that has caused things to go a certain way in your life, you are always and forever in recovery. Never forget that recovery is a lifelong thing. A person who was an alcoholic but they go to church and they have communion can't drink the wine that the reverend gives. So in most instances, you might have communion with Welch's grape juice. Why? Because it takes just a sip to mess somebody up that was in recovery, because they're always in recovery. Okay? Social and cultural factors. Having friends or a close partner who drinks regularly could increase your risk of alcohol use disorder. The glamorous way that drinks is sometimes portrayed in the media also may send a message that it's okay to drink way too much. For young people, the influence of parents, peers, and other role models can impact risks. We have complications. Alcohol depresses your central nervous system. In some people, the initial reaction may be stimulation, but as you continue to drink, you become sedated. So you might fall asleep, you might get tired, you might pass out, whatever. Too much alcohol affects your speech, muscle coordination, vital centers of your brain. You know, we've seen this. Yeah, brother, fuck you. You know, we've seen that. You know what I'm saying? We've seen people, you know, we've been there. I've been there where I couldn't walk right. I was out of it. My muscles I felt tired. You know what I'm saying? By over drinking, you know. A heavy drinking binge may cause life-threatening coma or death. This is a particular concern when you're taking certain medication that also depress the brain's function. Let me give you a story. So one day, I was out with some real good friends of mine, and we was at a party, and I had took some medicine. I can't even remember that medication, but it was a medication, and I believe, I want to say it was narcotic, and I went to the party and I forgot. I filled a cup this size up with some Tangeray. Lord have mercy. I'm not even going to tell you what happened, but I'm going to tell you what happened. I passed out. I mean, I'm standing there and I'm feeling lightheaded, and I fall on my people. They were sitting on the couch, and I was trying to get to a space where I can like lean on, but I was unable to really get there because I was actually trying to sit down because I felt it coming, and I blacked out. I passed out. So just know it's real. You know what I'm saying? Excessive drinking can reduce your judgment skills and lower inhibitions, leading to poor choices, dangerous situations, or behaviors including motor vehicle accidents, and other type of accidental injuries such as drowning, relationship problems, poor performance at work or school, increased likelihood of committing violent crimes or being the victim of a crime. Legal problems or problems with employment or finances, problem with other substance use. Remember I said that, right? That alcohol is a real gateway. Engaging in risky, unprotected sex or experiencing sexual abuse or date rape. Increased risk of attempted or completed suicide. That's deep. So a person that's going through some mental health issues, emotional issues, they drink, they might do something that they wouldn't do if they were sober, but the alcohol gives them this extra courage, and it's courage, but it's your judgment is off, you know. So just remember, those are some of the things that impact alcohol impact as far as your safety. Now with your health, I'm just gonna just say the few things, man. It's maybe 10 things that I'll just drop down. Liver disease, digestive problems, heart problems, diabetes complications. I'm a diabetic, so I'm gonna read this. Alcohol interferes with the release of glucose from your liver and can increase the risk of low blood sugar, hypoglycemia. This is dangerous if you have diabetes and are already taking insulin to lower your blood sugar. So hyper, and hypo. So hypo meaning you are producing insulin in your body and is eating up all the sugar, and your blood drops, as opposed to hyper, right? Hyper, you don't make enough insulin to eat up the sugar in your blood, So your blood sugar go up. And the funny thing about it is hyper and hypo gives you the same exact feeling. Just to let you know. It's, sweaty bathroom, shaking, flashes and everything like that is the same exact feeling because I've experienced both sides of it. Sexual function and menstruation issues, eye problems, birth defects, bone damage, neurological complications, weakened immune systems, increased risks of cancer, medication, and alcohol interaction. That happened to me. I was just saying that. Let's deal with some prevention. Early intervention can prevent alcohol related problems in teens if you have a teenager. Be alert to signs and symptoms that may indicate a problem with alcohol. Loss of interest in activities and hobbies and in personal appearance. Red eye, slurred speech, problem with coordination, and memory lapses. Difficulties or changes in relationship with friends, such as joining new crowds. Declining grades and problems in school. Frequent mood changes and defensive behavior. You can help prevent teen alcohol use. Set a good example with your own alcohol use. How about not drinking it in front of your children? Talk openly with your child, spend quality time together, and become actively, wow, actively involved in your child's life. Let your child know that behavior you expect. So you got to be on point. You got to say, look, this is what I'm expecting from you. This is what I need you to do, and what the consequences will be if he or she doesn't follow the rules. So we have some diagnosis and treatments. You're likely to start by seeing your doctor. If your doctor suspects you have a problem with alcohol, he or she may refer you to a mental health professional. Okay, so they're going to ask you, this is what they're going to do. They're going to ask you several questions related to your drinking habits. They're going to perform a physical exam. They will do a lab test and image test. They're going to complete a psychological evaluation, and they will use the DSM-5 criteria. This is the Diagnostics and Statistical Manual of Mental Disorders, 5th edition, published by the American Psychiatric Association. This is often used by mental health professionals to diagnose mental health conditions. Treatments. So we have a few treatments. We have detox and withdrawal, learning skills and establishing a treatment plan. This usually involves alcohol treatment specialists. It may include goal setting, behavior change techniques, use of self-help manuals, counseling, and following up care and treatment center. Psychological counseling, oral medication. Now, I didn't know they had oral medication for alcohol, but a drug called disulfiram or antabuse may help prevent you from drinking. Although it won't cure alcohol use disorder or remove the compulsion to drink, if you drink alcohol, the drug produces a physical reaction that may include flushing, nausea, vomiting, and headaches. So yeah, they got a drug that does that. That's kind of dope. Injected medication, Vivitrol, a version of the drug, naltrexone, is injected once a month by healthcare professionals. Although similar medication can be taken in the pill, the injectable version of the drug may be easier for people recovering from alcohol use disorder to use consistently. Continued support, we already know what that is. Treatment for psychological problems, medical treatment for health conditions, and spiritual practice. I can tell you for a fact that spiritual practice definitely helped. Like I've said several times in a few of my other videos, my mom went to church. She had the help of her spiritual leader, and that helped tremendously. And then they have residential treatment programs. Okay. We have a few lifestyle and home remedies. Consider your social situation. Make it clear to your friends and family that you're not drinking alcohol. Develop a support system. You got to get your friends and your family to join in. You know what I'm saying? So if they drink, oh, look, I'm not drinking anymore. Please don't drink any alcohol, and I need your support. develop healthy habits. So if you like to drink, how about go out and do some exercise? I mean, working out is always a good, major win when you're trying to get healthier. And then do something that don't involve alcohol, like go to the zoo. You got alternative medicine like yoga, meditation, and acupuncture. If you guys are looking for some kind of help, you always have AA, that stands for Alcohol Anonymous, or Women for Sobriety, or AL Anon and Alateen. These are Alcohol Anonymous for teenagers and young people. If you are interested in finding any of this information out, please feel free to go on mayoclinic.org. This is where I got my information from, and I threw my little, you know, feelings and my little stories in. But if you are really interested in trying to find help, if you do have an alcohol problem, you can always search in your phone. Everybody have a smartphone now. What you want to do is you want to look for nearest AA in my neighborhood or near me, and let's see. I'm gonna try to see if I can find this in my let me see in my phone. I probably will be able to. Let's see. I just want to show you how easy it is. Okay, so this is my phone, and I'm gonna search. I can actually ask Siri, but she be acting stupid sometimes. So, so we have the nearest Alcoholics Anonymous is Beach Boulevard, Jacksonville, Florida. It came right up. So, if you really out there and you're looking for help, like I tell anybody anytime when I do my videos, I'm always willing to talk. I'm always willing to be a support system, because that's what Talk Life is all about. It's not about me. It's not about you. It's not about them. It's about us. We can only become great if we support each other. We can only become as strong as our weakest link. But as long as we keep pulling our links, we're going to be stronger. Don't feel afraid to reach out to me, man. Anyway, it's your guy. It's your man, Mr. Talk With, Talk Life TV. By the way, one more thing. Make sure you guys follow me.